Today, we thought we would talk about mindfulness in children. And this was actually a topic that was requested of me to give a lecture on it. And people liked it, so I made it a topic for today, too. And it's a pretty intriguing topic. The Academy of Pediatrics now recommends screening for social determinants of health, including adverse childhood experiences, and using a trauma-informed approach to pediatric care. But they don't actually tell you what you can do about it. I think that that's something that really we need to have some practical strategies. But this is clearly important because we know that the more early adverse childhood experiences the adult had before they were 18, the shorter their lifespan and the more they have chronic conditions and at risk for chronic conditions and mental health problems. Now, not everybody gets them, but if you have 6 ACEs, your life expectancy is actually 20 years shorter. And if that doesn't sort of strike you as an area that needs to be addressed in terms of preventive healthcare, I think it's just a stunning kind of number. So the philosophy, the idea about how toxic stress works is that excessive or prolonged activation of the physiological stress response systems in the absence of buffering protection afforded by stable and responsive relationships is what ends up hurting your body. And stress has been associated with all kinds of problems that we see every day in pediatrics, from obesity and sleep problems, anxiety, depression, ADHD, and asthma. So even if it doesn't actually cause these problems, it can exacerbate these problems. So if you think about adverse childhood experiences, you can see things like these symptoms being exacerbated by having had adverse childhood experiences. So these are things we see every day in pediatric healthcare. But one of the things that is probably intuitive to you, but you may not know the research, is that when the parent is stressed, children tend to have more behavior problems. And when children have more behavior problems, parents are more stressed. So it's really a vicious cycle. And it's a component of care that sometimes is overlooked, is that maybe we need to help people with stress. And of course, we try to do that by ameliorating the child behavior problems, but there's some things that you can do to help people with stress itself, because we can't always fix the underlying problems. So what are the things we can do to help parents with their stress? Well, first of all, ask them about it or do a screener for it, and help them understand the connection between the stress that's going on in their family and how children get stressed and how it affects their behavior. And to some extent, I think we should be thinking about teaching parents how to manage their own stress as part of what we're doing in a comprehensive approach to the child's well-being. So here's some things we know can help reduce stress. Well, first of all, just recognizing what it is. That in itself can be helpful. Sometimes being able to name it and understand where it's coming from rather than having it wash over you and jazz you up without really knowing why. And then some of the problems with having stress that seem to be the mediators of those bad mental health and health outcomes is maladaptive coping strategies that people adopt when they're stressed. So it's the coping strategies themselves that kill people, actually, such as overeating or doing things to numb your mind and your feelings, like doing video games all the time, drinking alcohol, taking drugs. We clearly know that people sometimes get involved in drugs and alcohol because they're distressed, and they are using that as the way they're dealing with their distress. Sometimes people have excessive sexual behaviors as a way of just engaging and getting their minds off of bad things that they might otherwise be experiencing. And a lot of these are mediated by negative thoughts, a lot of the distress that people experience. So just thinking about negative thoughts themselves, if you think about bad things that happened in your past or you have regrets about your past, that's part of a syndrome of thinking that goes along with depression. And if you're anxious about the future, that's called anxiety, right? So that these negative thoughts they're very valuable to us in general. They keep us from repeating mistakes, and they help us get ready to take action. So if you're worried about the future, you're going to do some hurricane preparations or whatever it is you need to do to be ready. But on the other hand, sometimes the thoughts themselves are part of the problem. They paralyze us with anxiety. We can't actually do the things we need to do to get ready. They take away our pleasure in life. They interrupt our sleep, and having poor sleep is bad for basically every health condition and mental health condition and general well-being. And the thoughts themselves can stimulate your physiological stress response. So I'm sure that you've been in near car crashes. Like, who hasn't been in a near car crash? Hopefully you've never been in a real car crash. But when you jam on the brakes and there's the screeching and hopefully no crunching, you feel the stress response go through your body. But now, just while I talk about the idea of a near car crash, I probably evoked some of that physiological stress response just by talking about it, just by thinking about those things. And of course, while negative thoughts can be protective, they don't actually change the course of events. So being able to have better awareness of your thoughts is actually important, and it's an important part of cognitive behavioral therapy, actually. It's a very core piece of cognitive behavioral therapy is to notice negative thoughts and to counteract those thoughts. But mindfulness is another way that you can work on that. So some of the ways that you can actually advise people to help cope with stress more positively would include getting some exercise. There's more evidence now that exercise can help in a variety of conditions, and it doesn't have to be extreme exercise to be helpful. Even just walking every day has some benefits. Getting enough sleep, eating healthy food, making sure that you're communicating your feelings, but also just having a social support system. And then mindfulness is a piece of that. So I'm not saying that mindfulness is the cure-all for anything. It's just one more strategy, and it's a strategy that's really available to everybody. And I think that that's one of the things I like about it. And also the fact that it can be, once practiced, it can be done in a very short period of time. The practice can be short, and the intervention can be used on the spot, on the fly, even sitting at a stoplight, if it's a long stoplight. So where did this mindfulness become part of American medical culture? Well, Jon Kabat-Zinn, who's from the University of Massachusetts, learned about mindfulness from Buddhists, and he created a program called the Mindfulness-Based Stress Reduction, so MBSR, and I'm going to make some reference to this because this is the most evidence-based mindfulness program that's out there. And if you want to understand like what we're aiming for here with mindfulness, it's basically paying attention in a particular way on purpose, so purposefully, staying in the present moment and not judging your thoughts and experiences. So it's a state of non-reactivity, awareness, focus, attention, and non-judgment. It's kind of as though what you're trying to do is let your thoughts and feelings pass through you with a neutral mind, as though it were a movie and not something personal to yourself. Now, if you think about that, that's also a process of decentering, and decentering has a lot of value for people when they're in distress. So the components might be summarized as saying it's intentional, it's attentional, and it's a shift in your attitude. So Jon Kabat-Zinn, I got to listen to a seminar with him just a couple weeks ago at the APA meeting, says that in Japanese, mindfulness translates into heartfulness. And you may have been aware of a New York Times article just this week showing that cardiologists have to learn more about the emotional aspects of cardiac disease. Now that they've mastered most of the physical parts of heart disease, that it's the mindfulness part that can be hurtful. I mean, it's the emotions that can be hurtful to the heart. So those two things are pretty closely connected together. So basically what we're trying to get people to do is to have them become more aware of their current inner and outer experiences. So for example, where you're sitting today, you may be on one of those uncomfortable plastic chairs, or you may be in a very comfortable chair that can tip back, And you may be aware of the air conditioning working or not working, of your stomach rumbling because it's almost lunchtime. And those are all inner and outer experiences. So trying to focus on your current experiences rather than letting thoughts of the past or the future go through your head is part of the exercise. But no one expects you to actually blot out those other thoughts. So as you're sitting there and I'm talking to you about how it feels to sit in the chair you're in, you may be instead thinking, oh, I should have put my lunch in the microwave so it would be done before this session is over. But when you're doing mindfulness exercises, you notice that your attention has drifted and you put the effort in to bring it back. But you do this in a cognitively non-elaborative and emotionally non-reactive way. Like, don't judge yourself. Don't say to yourself, oh, listen, if I'm going to get these credits, I really need to pay closer attention to this. Just notice that your attention drifted and bring yourself back to the present moment. And actually, most mindfulness programs have a kindness or compassion building component, an expression of gratitude, and sometimes even activities that, especially for children, of being kind to other people. And you say, what does that have to do with mindfulness? Well, when you're being non-judgmental about your own thoughts, it can help you be non-judgmental about other people and what they do. And so I think that is a component that's very naturally connected. I love this picture. So there's somebody, this is the modern American parent, right? Actually, the modern American parent would have a cell phone in their hand while they're thinking about all those things, supposedly taking a walk with their kid, whereas kids more naturally are noticing their surroundings and not obsessed by these different thoughts. So trying to become less cluttered, at least for moments of the day, is a useful exercise. So what is in the mindfulness-based stress reduction program? Well, it's 8 weekly 2-hour sessions. There's a 6-hour day-long meditation retreat. There's daily home practice using audio CDs that help you with mindfulness instruction. And then there's formal mindfulness exercises. And they include things like the body scan, sitting meditation with awareness of breath, and mindful movement. So body scan means basically as you're sitting there, notice how your arms are resting on the arms of the chair or sitting in your lap. And notice whether your back is tense or relaxed. And notice how your feet feel contacting the floor. So that's the kind of things that go into a body scan. Then the sitting meditation with awareness of breath can be summarized in this poster from De-Stress Monday, which is belly breathing. So basically the idea is to make yourself more aware of something that's going on every day, every minute, and that is you're breathing. You better be, right? But in this case, you're focusing on relaxing and letting your belly stick out as you inhale, and then noticing the air moving in and out through your nose or your mouth, and simultaneously noticing the stress leave your body while your mind becomes calm. So this is a pretty nice brief description of what sitting meditation with breathing exercises look like. So what's the goal here of mindfulness? Well, it's teaching useful things: focused attention, decentering, and emotion regulation. If you think about it, part of the problem with emotions is that they rush at you, and sometimes it makes you discombobulated. Basically, it makes you feel stressed. It makes you take action, leap from your chair, not pay attention to what you're doing. So when you practice mindfulness, you're also practicing regulating your emotions, which is something that we learn throughout our lifetime, starting in childhood, actually. And that people who are more successful with emotion regulation tend to have better lives and better interactions with everybody, and certainly better success in school as well. So it's a useful skill. So how does mindfulness do this? Well, when you are able to think about your feelings, both pleasant ones and unpleasant ones, and see them as being sort of like the weather. It's beyond your control. It washes over you, but then it moves on. This is a form of emotion education that helps you understand that you can wait out feelings rather than having to act on them all the time or rather than having to scream or panic or freeze up or punch the kid next to you if you're a kid. And there's another benefit, which is that if you can tolerate unpleasant feelings without dissociating or going blank, it's possible for some things that might have happened to you, like traumatic events, to be more available for you to figure out. Because when you go blank, you don't make progress in reducing the impact of those negative experiences and feelings. So what happens when we teach mindfulness to adults? Well, different studies have shown that adults have greater ability to cope more effectively with short and long-term stress. It can reduce stress, anxiety, and depression and promote overall well-being. And it can increase the moment-to-moment experiences, promoting reflection and self-regulation, empathy, and caring for others. So how impactful is training in mindfulness? Well, this is some data from a meta-analysis of mindfulness programs. And what they found was sort of a medium effect size from 0.3 to 0.6. But actually, they saw no difference between mindfulness-based therapy compared to cognitive behavioral therapy or regular behavior therapy or even pharmacological therapy for a variety of kinds of psychopathology. I'd love to hear Emily's reaction to that. The studies show that there's some effectiveness in both clinical populations. That means people who have been referred for or diagnosed with mental health problems, and non-clinical populations. But in general, clinical populations actually do better with mindfulness. They have a bigger benefit. But it's a little bit like ADHD. Like everybody can benefit. Like if everybody took stimulants, everybody's performance improves. But the improvement is more striking in people who are having difficulties to start with. Emily, are you familiar with any of these studies about mindfulness as impacting on psychopathology, knowing it's not ever the whole story, but any comments about that?
I don't know those studies in particular. I guess the obvious question is always, which kind of psychopathology is it effective for? I don't think it's going to be effective for all psychopathology, but for some it will be very impactful, given its connection, as you mentioned earlier, to some of the concepts of CBT and things like that in terms of being present and getting away from the cognitive distortions. So it would depend on what kind of psychopathology we're talking about, I would say.
Right, and totally, and anxiety and depression are the ones where it's shown the best effect. Of course, it's not going to fix schizophrenia and psychosis. It's not going to do anything for that kind of condition. So, but the good news about that is that those are the most common ones, right? Anxiety and depression are the most common ones we see. So it's nice that it's useful for those. So
an interesting comment we heard in our presentation yesterday. Reflecting on the fact that people with anxiety and depression have these thoughts that influence what they do, as opposed to ADHD, where they act before the thought and impulsively, and so you wouldn't expect it to have a big effect on some of the impulsive things, although there are some side effects that people get into with ADHD, but the basic underlying pathology might not be as susceptible to this.
Right. It's not as based on the thinking problem.
There's not thinking.
It's lack of thinking that's part of the problem.
Right.
Exactly. So the theory about teaching mindful parenting is that the parent who can basically suspend their emotions, take some deep breaths, and think about how they want to act with regard to their kid's behavior rather than reacting impulsively, act more reasonably. They have a more appropriate response, and they appear to be warmer and more compassionate to their kid, which tends to produce better behavior. So that's that that cycle that I was talking about back in the beginning, is that a calmer parent can use the strategies that they know or that they can be taught more effectively, and the kid is more open to hearing from the parent when the parent isn't all jazzed up and screaming. And the other thing about it is that parents may feel better about themselves and their parenting, so they feel less stressed and sleep better at night, and overall they're doing better. And I'm going to show you some data in a minute that shows that this is actually true. There's some nice books by Mark Burton, Bertin, And these slides from this presentation will be up on the Chattis website with the references in them if you're interested in pursuing any of the references. So the idea is parents should slow down, notice their impulses, really listen to their kids, and come to a more relaxed and peaceful state of mind. So here is one of the mindful awareness for parenting stress studies. Okay, so this is specifically teaching parents of children, in this case, kids 2.5 to 5 who had developmental delays. Now, the people who signed up for this program could have been anybody with a kid with developmental delays. Turned out that 85% of the people who signed up had kids on the autism spectrum. That shouldn't come as a huge surprise to us because we know how difficult it is having a kid with autism in many cases. And the components of the project were didactics on mindfulness, the psychology and physiology of stress and anxiety, and teaching about how mindfulness can be used in daily life to facilitate more adaptive responses. Then they did mindfulness exercises during group meetings and as homework, and they had discussion and sharing in pairs of parents and in the larger group. Now, you can't break out which of those things was most supportive because we know that parenting groups can be supportive in and of themselves, but this was a parenting group that had support and specific instruction in mindfulness. And the goals were to reduce the externalizing behaviors and improve the self-control of the kids, but also to teach parents to identify which interactions they were having might result in relational disconnectedness. In other words, bad stuff for the parent-child relationship. So here are the results. So 25% of the parents reported a clinically significant reduction in their own distress on a standard tool called the Parenting Stress Inventory. 35% felt that was a reduced impact on the child, on the parents, the family functioning of the child's behavior and problems. 18% had a reduction in depression symptoms, and 10% reported a meaningful change in their satisfaction with life scale. So interestingly enough, 29% reported a reduction in their child's ADHD symptoms, and 18% reported a meaningful change in child attention problems. So knowing what we do about ADHD, I was kind of surprised about those results because we don't think about this as being something that results in changing the child's core neurobiological functioning. On the other hand, ADHD is measured by parent report, right? That's how we look at it. So I think what was happening here is that the parents were being less distressed by their children's symptoms and therefore were rating their children lower on these scores. Pretty interesting stuff. So here are some more things from that study: reduction in stress impact, improvement in ability to cope, decreases in reported child behavior problems, increase in parent satisfaction with their own parenting skills, better relationship with your kid, and they continued to use mindfulness after the study. That was something that they gained as a skill. So all of that was talking about how to help parents use mindfulness, but in fact, can we teach mindfulness to children? Because children are experiencing stress too. And the same, you may recognize the slide because it's actually the same stuff I talked about with parents. And that is, things that help children with stress include recognizing they're under stress and recognizing when they have maladaptive coping strategies. And if you think about these items, a lot of these refer more to older kids, although the mind numbing of video games, we know that video game addiction is more common in children who are not doing well in some psychosocial areas. So in terms of peer relationships, in terms of anxiety or depression, it's a pretty good retreat, frankly, because when you're playing a video game, you are definitely not thinking about anything else. But we certainly know that teenagers with emotional problems are more likely to use drugs and alcohol, just like adults, and it leads into adult excesses. Promiscuity is a coping strategy, and the negative thoughts can be part of all of this too. So these are exactly the same things we discussed with parents, and how to manage stress are exactly the same strategies that I talked about that are appropriate for parents. Exercise, sleep, healthy eating, communicating your feelings, social support, and maybe some mindfulness too. So how does it work with kids? Well, there's a number of different programs that have been created and tested, and one of them is called Mindfulness-Based Cognitive Therapy. So you know about cognitive behavioral therapy. which includes some relaxation exercises and self-awareness in general, but not necessarily specific mindfulness exercises that you might call specifically mindfulness. So in an 8-week manualized group protocol for 8 to 14-year-olds, they taught the children the same sorts of things that are in the mindfulness-based stress reduction program, but they worked a little bit more to help the kids notice and identify thoughts and to just see them as just thoughts, and to practice non-judgmentally observing rather than avoiding or getting stuck in habitual thought patterns. And this is a different study, also on mindfulness-based cognitive therapy. They found that for children, it was better to focus on sensory observations rather than having them just reflect on abstract or interior experiences, because kids aren't as good at that. Whereas if you have them focus on what they're feeling or what they're tasting, I'm going to talk about that more in just a minute, that's something kids can get into. They're very interested in tasting. In fact, they actually are more sensitive to tastes than adults are. They have more taste buds actually than adults. So that's a good way to get them to move their focus onto something specific. They also found that they needed to use shorter sessions and less shorter breath meditation sessions, but to do this more frequently. So they had larger numbers of sessions and more frequent practice of the breath meditation that I talked about before as part of the training. And of course, it was really important that the parents were trained to support what was going on. They went to an orientation, they completed some homework, and they provided feedback for the program. So another one, which is used here in Baltimore actually, is called MindUP. And this is Goldie Hawn, the Hawn Foundation. So Goldie Hawn has taken on mindfulness, which is pretty cool. And this program was used with 4th and 5th graders. Again, sensory, mindful tasting, mindful smelling, cognitively, taking other people's perspective, and gratitude was a specific part of this program that built up to doing of kind things for others in the home, the classroom, and the community. So 4th to 5th grade, unselected children otherwise. How did it work? 24% of the kids were improved in their social behaviors. 15% got better in math, which I thought was really interesting and may have something to do with a reduction in anxiety, because we know that you do math less well when you're anxious than if you're not so anxious. 20% said they had better well-being and more pro-social behaviors. And there was a reduction in peer-nominated aggressive behavior. Now, what do I mean by that? Well, it turns out children are really not very good at telling you about how aggressive they are. They don't see what they do as particularly aggressive. But their peers are very sensitive to who's aggressive and very accurate in determining who in their class is more aggressive. So this is actually quite a robust measure for a reduction in aggressive behavior in the kids participating in the program. They also made them do a bunch of executive functioning tasks, and the children in this program did better on the most difficult ones of those that required response inhibition, working memory, and cognitive flexibility. Now, those kinds of executive functioning tasks, of course, are things that we see as problems in kids with ADHD. So this is pretty intriguing. The effect size was pretty good, 0.55. That's a pretty good effect size for this program. It's also been adapted for teens, 14 to 18 years old. In the teen group, it was focusing more on their interpersonal life, because that's what teens are into, right? The stress of social issues for them, and their performance challenges, like stress about school, for example, and being able to do that. They had a weekly check-in as a group and worked on making sure that people had a way to use mindfulness in their daily life, but the sessions were shorter and there was no day-long retreat. Otherwise, it was very similar to it was based on the MBSR that I told you about before, so it's called MBSRT. There are a bunch of other programs that may be available to you: Inner Kids, Breathe, something called Mindful Education, which is in the classroom, and a really interesting one called Soles of the Feet. And this was used for kids with autism, conduct disorder, and Asperger's, which is now considered part of autism, of course. And basically, they were focusing on having the kids walk around and notice how their feet felt while they walked around. And it had significant benefits for the kids. Now, I wanted to make sure that you knew that there are apps available for this sort of thing now. Actually, at the American Psychological Association meeting, they specifically endorsed Headspace as one of those apps. And so I downloaded Headspace and took a look at it, and it's really cute and really good. And it's got child age specific exercises. So I would recommend that you take a look at it. It's free. There's another one called Calm, but you may have others. Okay, so you can do it with kids, but how well does it work? So overall, there's a small effect size compared to active alternative treatments. So in other words, I'm not saying just prescribe mindfulness and nothing else, but I also know that you guys down there in Waldorf may have a shortage of other services or a long waiting time, or kids can only go once in a while because it's such a long way to get treatments, and it's something that can be added to other treatments. But for clinical samples, the effect size, that means, again, kids with diagnoses, the effect size was actually in the moderate range and nearly 3 times as effective as it was in a non-clinical sample. It addresses some of the core symptoms of psychopathology with twice the general effect size. The older the kid, the better they tend to do with this. But as I showed you, kids as young as 2.5, when the parents learn mindfulness, that can be helpful. And other studies of kids just in early elementary school found that they could implement some of these strategies. So the benefits of mindfulness include reducing symptoms of depression, PTSD, anxiety, and negative affect, and helping have something more positive as a coping strategy, hopefully to avoid then some of the maladaptive coping strategies which are bad for you. Improving sleep. Sleep improves everything, so improving sleep is good. Building self-confidence, that helps everything too. And actually improving classroom behaviors and performance. Improving attention, there's just a little bit of evidence for that, even some EEG evidence. And the other part, which I made reference to at the very beginning of this, was to reduce some of the negative effects of exposure to adverse childhood experiences. Like, we can't take those experiences away, but we can take away moments of time when you have to be thinking or feeling those feelings, and perhaps reduce toxic stress reaction to reminders of those things from the past as well. So now we're going to get to what can you do? What can you do in your practice? So typically, mindfulness training may be as little as 4 and as many as 20 days of instruction and practice. But it turns out that even 5 minutes a day of practice has been found helpful, and it works at lots of different ages. So we should be considering it basically with almost all of our patients. And thinking about what's available in your community, mindfulness is actually part of lots of stuff that is out there already. So for example, yoga. Mindfulness is really part of yoga. It's kind of built in. So I like to actually recommend yoga for kids. And they often find yoga to be more acceptable to them, as well as being more accessible to them in some cases than other kinds of treatment. Tai Chi is another mindfulness-based movement activity that's deeply embedded in the Chinese culture. Regular meditation is something that anybody can do, even if it's not called mindfulness. Art therapy, actually, coloring with crayons has been shown to induce some reduction in stress, which is interesting. Group therapy can include mindfulness, and even religious services often will have a period of meditation as part of them, and something to think about as being a source of this kind of experience for people. So you can recommend that parents declare moments for their child to stop and take deep breaths and notice the sounds and sights and feelings and smells around them. And they can do that just by declaring moments during the day or taking an awareness walk around the block. And here's a cute book which pictures of a parent doing a mindfulness walk and the child noticing little things as part of the walk. So all of that constitutes a kind of mindfulness which fits in nicely with the activity level of young children, that they like to be on the go, but they can be on the go and noticing at the same time. Another one, which fits into the sensation aspect, the sensory aspect, is eating food mindfully. And it's nice to do that at the beginning of a meal, because you may have noticed for yourself, the first bite is often the one that you really notice the most. And after that, people kind of go into mindless eating, which actually is associated with eating too much, like not noticing your satiety cues. So for example, eating in front of the television is, you probably have heard of these studies. When kids are eating in front of the television, they eat much more than they really needed based on how hungry they were. And they don't notice that they did, and they underestimate how much they consumed. So perhaps mindful eating is something that could be helpful just in managing weight. So when you take a look at this picture of the beautiful symmetrical strawberry with those little seeds on the outside, and you can imagine you just got it out of the refrigerator, and you take a bite, and you can taste the little tartness to the strawberry followed by the sweetness and the crunchiness of the seeds. As I talked to you about that, did anybody start to salivate?
Yes.
Yes, Ray admits he was salivating and hasn't had lunch yet. This is the kind of talking that a parent can do with their kid. And actually, there are people who keep a box of raisins in their office and can do this exercise with raisins. Raisins don't spoil very easily, so it's a really good choice of something that you can do simply as a way of instructing the parents and the kids in a form of mindfulness. And as I mentioned, sensory mindfulness is actually one that's quite accessible to children. They get it. Here's another one, which is useful to do. Often, this is a good one to do right before bedtime. So there is a child lying on her back with a stuffed animal on her belly. And what the child is instructed to do is to rock the baby animal to sleep. So by watching their belly go up and down and the animal moving up and down is a good mindfulness exercise. Now, I like this picture a lot. Down at the bottom of this slide, you'll notice that Elmo has taken on mindfulness, and there's an Elmo music video. Just, you can Google search it, or you can use the link here in this slide. It's a pretty wild video. It's not very relaxing, but because they're talking about using mindfulness to deal with aggressive feelings in that video. So that's another one you might want to take a look at. And here's one of my favorites. It's called the glitter globe. So looks like a snow globe, right? So the idea is that when you practice this before you need it for an upset, but the child shakes the glitter globe, watches the glitter move around rapidly and obscure the thing that's inside the glitter globe in some cases. And the parent helps the child translate this in thinking about how that glitter rushing around can be like our thoughts and feelings, like anxiety and worries, rushing around at us and making it hard to see clearly. And while they watch the glitter start to settle down slowly, and they watch their breaths at the same time, it allows their thoughts and their feelings to settle down, and so that they can see more clearly and settle their minds. Now, you notice that while I talked about that, I was doing something with my voice, which is slowing the pace, leaving pauses in it. And these are techniques that are part of routine regular hypnosis, also hypnotic induction. But they're useful for anybody to do, and you can demonstrate that and keep a mindfulness jar in your office. And there's in this handout, there's a recipe for how people can make a mindfulness jar using cheap materials. So they don't have to go out and buy one. They can make their own, which is a cool thing to do with kids. Now, as kids get older, they might think a mindfulness jar is weird, but probably won't. But the idea of incorporating some of the gratefulness or by keeping a gratitude journal, this also has some efficacy in relieving depression. Trying to notice the things that went well for you helps you not dwell on the things that are making you feel bad or that went badly. And some of you may have the 1 second everyday app on your phone where you take a little video clip and save them up. And just thinking of that as being a routine part of your day can be a helpful way to generate mindfulness.